Get to listen to presentation by Department of Social Services over their budgets. It will be a lengthy hearing for those of you listening in. With that, the other thing that the department's talked to me about in front of the senators, they have placed a list of items that go through each of their 7 books that show the core reductions. So we're going to, at this point, unless I have a senator come in and get real excited about something, we're going to go through those core reductions at the beginning. It doesn't mean that we're not going to ask other questions as we go through books and stuff, but I've agreed to do that. Okay. With that, Director, I'm done with ground rules. Please begin.
All right, good morning. Jess Bax, Department of Social Services. And as we walk through our 7 budget books this year, we will focus on, per the chairman's instructions, the core reductions, which we'll talk through first. You have a separate document. And then we will also make sure to talk through all new decision items and transfers as well. So there is, before we get into the book, I think I'm going to turn it over to Courtney and let her talk through the reductions document, because otherwise we would stop on about 300 different pages for reductions, but we're happy to stop anywhere if someone has questions.
Good morning, Chairman Black and committee members. My name is Courtney Stalter, and I am the CFO for the Department of Social Services. The handout that Chairman Black was mentioning looks like this, and this is our core reductions taken in governor's recommendation for all of social services. So this goes book by book and page by page. We do have 7 budget books, so each book is broken out. On the back, last page, you can see the grand total for social services is $1.4 billion, 270 million GR. You'll note that there's 238 FTE mentioned there, but those are all due to fund switches. So there's no net change in FTE for social services due to reductions. So at a high level, reductions associated with HR1 are $502 million, 68 million GR. Reductions from the FMAP adjustment, 134 million, 91 million GR. Reductions for lapse, 155 million. Reductions associated with fund swaps, 26.7 million. Reductions of TANF, 17.9 million. And then DSS also took a general E&E reduction of 20%, which is around $300,000 for our department. If there's no questions, we're going to start with book 1 of 7.
I do have one question as you went through that. You know, something so important, it seems to me like for the state and in your department, the GR reductions, I would expect the department tried to make sure that that had not a negative impact anywhere on any reimbursement from federal
Correct.
government. Those were actual deductions that we believe, the department believes, that we can take with the matching reduction and do as little or no harm as possible.
Correct. We worked with the administration before department requests, and we looked at all of our funds, and the GR ones do not have matching that's going to be impacted. Yeah, you want to add?
We also looked just across the department at our E&E lines to make sure that we're being as fiscally responsible as possible during tough budget times. So there is a 20% E&E across the board in all divisions, but we watched closely the years prior and what was spent specifically in our divisions where there is a lot of travel associated with visiting families or clients in their home. So we, at this point, do not see that having an impact on our operations to individuals we serve.
Well, as you're aware, Director, we worked and passed on the Senate side the supplemental budget for 2026, and there's tremendous amount of discussion. I'm not pointing fingers at the department or anybody else, because I realize after being here 9 years, some of those supplemental dollars are self-inflicted that we do in the legislative. You probably shouldn't shake your head yes or no, but they're somewhat self-inflicted. With the budget books that you have in front of us, as much as a person can guarantee, one person guarantee, if we just took this the way it is, your guesstimate now would be there would be no need for supplemental in this department next year?
Correct. The largest pieces of our supplemental in the Department of Social Services are very similar to the supplementals that you might see in Department of Mental Health and Department of Health and Senior Services, and they're associated with growth in utilization, more need, and people using more services within the Medicaid program. Those projections are provided every year, and they're included in this recommendation. There is an updated month of projections that we've provided the House and Senate budget support staff with, and that billing gets updated every month, so it's to the best of our ability. But in the past, the large supplementals are generally associated with those full projections in utilization not receiving funding or being lowered from the recommended amount. And I can have, when Josh and Tony get up to talk about more detail, I think we went through a little bit in the House, kind of line by line on where each of the growth was in each of the program lines. So happy to do that if anybody's interested. The other piece that there's never a known factor around the need for a supplemental is with new federal legislation. And so you do see that reflected in this year's supplemental budget. On July 4th, there was federal legislation passed, which was pretty influential and substantial in changing many of the social services programs and federal funding for those programs, both in a net positive and a net negative, so Rural Health Transformation Program, as well as new requirements for SNAP and Medicaid. So if things like that come up during the year that we can't anticipate, well, you also will most likely see that. And what I will say is there may not be new legislation that passed at the federal level, but there is very little guidance that's out thus far on the Big Beautiful Bill. And so as we go through the year, a good example is we do not yet have the detailed requirements from CMS on the work requirements for Medicaid. So as we get those detailed requirements, we may have to make adjustments in our plans.
Thank you, and I will stop after this next statement. You may end up with a yes or no answer on the end of it, but when we talk about that utilization and the change and the reports that's supplied to Leadership Appropriation Budget Committee, which is ultimately our appropriation and budget staff that help work on those numbers, and even as you recognize, when we passed supplemental bill, we made another change within your department and other departments around that utilization. And I think that in this case, appropriation staff, budget staff, and your staff trying to come up with those dollars do their best to right-size that all the way through. There was some increase required and some decrease on the latest numbers that were provided to the appropriation staff in the Senate, and I hope that, to my knowledge, there was no problems your staff thought with what changes they made there, right? And I think I stated this as well. Yeah, that is a yes or no, and then I'm going to state one more thing and shut up.
That's correct.
For a minute. Okay, and then the last thing to, I don't know the people that work, that are sitting out in front of me or the people listening, but in my other lives that I've been before I made the decision to do this, most of our budgets, we made a decision to accept a budget with a group of people that voted on it or all agreed at the beginning of whatever year that was. My home budget was done in March, and my work budget was done on July 1. But the thing that we were allowed to do there was every month we made adjustments to that budget, and state government, the way we're set up, can't do it, and I don't want to start doing it. So I'm not proposing that, to come back every month and make monthly adjustments. But I think your department and other departments are doing that and then trying to provide us supplemental as close as possible. With that, I will be quiet. Any senator or guy thing here at the beginning? Otherwise, we go to these reductions.
Okay, I think that takes us to the Supports Divisions book, which is book 1 of 7.
if there are any highlights within this one that you think we might hear about, highlight it here, and then people have questions. Senders, you can have questions here, or when we go in that book. If you've got questions already ready, we'll stop and make sure we take care of those.
Happy to answer any questions. The first new decision item is on page 2 of Book 1. It is the new decision item for HR 1 implementation. So mentioned the federal legislation that passed. You did see a portion of this in the supplemental. There are required deadlines within that federal legislation for work requirements. Well, some of the deadlines have already passed, but you have a handout with you that is well, you have several. One looks like this. That is a guide to kind of the major key provisions of HR 1 implementation. And then we created separate informational sheets on the error rates for both Medicaid and SNAP and how that will impact the social services budget in terms of what we can do to mitigate those costs. The costs for HR 1 to the state fall into, I like to say, kind of generally 2 categories. One category is costs that are reductions in federal match that we really can't do anything about. That is one you'll see this year, which is in the decision item on page 2. And that total, by the way, is $294 million, $294.6 million with $34.9 million general revenue. And so for that, we have one of those, which is the SNAP admin. So prior to HR 1 passing and currently today until October 1st of this year, the federal government matches a 50-50 reimbursement for us in our operations of the SNAP program. Currently, all of the SNAP benefits that go on the card are 100% federally funded. So that funding that's placed on the SNAP card for food benefits does not even pass through our budget in the state, goes directly on the card from the federal government. But the staff who run the eligibility and the systems that process the eligibility, that is all done through SNAP admin funding from the USDA. The legislation changed that match to, in October, it will only be a 25% share from the federal government. That has a $31 million impact this year coming because it's just not quite the full federal, it's a federal fiscal year, so starting in October. And then when we get to a full year, it'll be slightly over 40 million general revenue impact to maintain that program. So that's where Courtney mentioned you saw the fund switch for the staffing. It's associated with our admin changes from the federal level. The other piece of costs that is probably the most major that are out of your control as a state is the reduction in provider taxes and state-directed payments. Those were frozen as of July 4th, and then so you can't create any new ones as an FRA or finance mechanism for your Medicaid program. And then over the next 5 years, they will reduce the capped percentage we're allowed to use for our FRA provider taxes from 5% down to 3.5%. And so that will impact the state starting in FY29. So that's not in this budget book, but for awareness, we wanted to kind of make sure everybody is aware of kind of the planning pieces out for all of this. The other changes that are happening within this fiscal year that you'll see in the budget for page 2 is the Rural Health Transformation Program. Missouri competed with other states for funding and was awarded the 9th highest award in the nation. There's $216 million annually. The updated budget for $216 million was 5 years, every year for 5 years. So over $1 billion for over the next 5 years. And That is you'll see staff associated with that in the new decision item. We originally put 5 in our budget and 5 FTE for a rural health transformation office. And we then got privy to other states and realized that most states had around 40 staff or more. And we learned more about the admin requirements in carrying out the rural health transformation program. It's being managed like a grant, very similar to a CDC grant with line-by-line approval and lifting of restrictions after CMS review. So not similar to the way other CMS funds have been handled in the past. So what we have done is updated that through a GovRec in the House to be 11 FTE. And so you'll see that as well. And then the last piece of this is what we talked about in our supplemental is the technology enhancements to our current systems, and then the building of what we need in order to meet work requirements. So work requirements go into effect for Missouri for every state, sorry, not just us. We're in this with every state. And that will be January 1st of next year, which is an extremely aggressive timeline. No state has fully implemented Medicaid work requirements. I believe Arkansas did briefly, and then there was a lawsuit. Georgia has implemented or was on the path to implementing work requirements through an 1115 waiver for their Medicaid program. Their system costs thus far have been $110 million. So we're looking across the other states that are planning for this. We think we've got a good plan that's fiscally responsible, and utilizing most of the funding is going to enhancing our current systems. And then we also have funding going to what will become income verification, and then the ability to connect with other data, including MMIS or Medicaid claims, so we can verify whether someone has an exception for medical frailty, that sort of thing. We also need to be able to verify not only work hours and income, but to be able to verify educational hours if someone's in school, or if they have volunteer hours as well. So training, education, school, and work all count. It is 80 hours a month, and so we don't have specific guidance from CMS on exactly one big piece that I always bring up as an example because it's an outstanding question. With the federal government is states could choose the month prior or the 3 months prior to look at for meeting work requirements. And but if you have someone apply in March, say they apply on March 28th, and you look at February and they did not meet the work requirements, but they've already worked their 80 hours in March. So does the month that you're in count? We have yet to receive some of those answers, so we're doing the best that we can to build in as many of the requirements as possible. We did get the approval from CMS for the 90-10 match on this system build, which is very exciting. Missouri was the first state to be approved for that. And so we are on a path to make sure, and CMS reviews your plan. They don't just review, they review your scope of work for future vendors, your current vendors, and your plan with them, and your milestones, objectives, and outcomes. So that part is all in an effort to meet work requirements, but also in an effort to mitigate the fiscal impact of, this is not a CMS agency for these two one-pagers that have the error rate fiscal impact. This is federal law. So federal law would have to change in order for CMS to not carry out these financial penalties for the state. That would begin both next fiscal year for the SNAP error rate. And then for the Medicaid error rate, it says that it starts in 28-29, but the year that they will be auditing on is starting on July 1st of 2026, so just a couple months from now. And with that, I will, unless there are questions, we will move into our FMAP adjustment new decision item on page 24.
I do have one question, and again, I've said here I'm in my 10th year. listening to the budgets, and I've never asked this before, if I ask, and I'm not asking, but if I ask for the departments that have federal matches within Medicaid primarily, to tell me what those different matches are, to go program by program and look, would that be a page with 4 or 5 lines on it? Or is there so much variation between what that federal match is compared to state? And my understanding is it's a liquid number as well in cases. Would there be pages, a full page type? Or is that, am I asking something that's just stupid that shouldn't even be asked?
One page? All right, I'm gonna let,
Would one page
Would one
mean
page?
all departments receiving it or just DSS? Okay, so it's not hundreds and hundreds of different
what about the Wildcat?
matches, but it might take more than 3 lines to do that.
Yeah, no, it would definitely take more than 3 lines to explain the different match rates that we have, but we also have a cost allocation plan on how all social services employees are allocated across different grants based on the job duties that they do. And that document is several hundred pages, and it's updated. It's kept updated every month and submitted to the feds every quarter.
I'm going to use the word audit. CMS audits or looks at our numbers with what regularity?
I mean, we're continuously being audited in different forms and fashions, different
Okay.
programs. They do have to review and approve the PAWCAP, the cost allocation methods that we use, and they approve those every quarter after we submit them.
Okay, you can quit teaching me on a microphone and Appropriations Committee. Let's go to this. But most people think that this is more simple, I think. And I'm not talking about senators. The public thinks this is a much simpler system than it actually is. Senator Harrison?
Just one question. You gave some good handouts here. The error rates, because I just want more information. I see that it went from 569 all the way up to 12 and then back down a little bit. Can you kind of explain that to me on the SNAP benefits is what I'm talking about. I should have been more specific. Can you kind of explain that to me?
Yeah, absolutely. So I think what you see in, it's on the back page of the SNAP error rate handout, looking at that middle row that reports the state reported payment error rate. You're looking there at FY19 would be prior to absorbing the adult expansion group into the work that our staff do. Our staff do both Medicaid and SNAP eligibility. And then 2021 are reflective of the COVID public health emergency flexibilities. And so there were not as many requirements that we were held to. And then you start to see the increase after as we go out of the public health emergency. I think so prior to, if it's helpful for me because I wasn't familiar, even though 20 years in Medicaid, I wasn't familiar with a SNAP error rate before I came into this role, and I don't think it was something that most state legislators had to pay attention to because the federal government only applied financial penalties if you were above the national average, and then you could still create a corrective action plan and they could waive those financial penalties. So in this most recent year that we have, Missouri, and in past years, Missouri has consistently been below the national average.
That was going to be my, excuse me, that was going to be my next question. So we're below the national average. I was going to ask how we compare.
Yep.
Okay, thank you.
Senator Nuremberg.
I have a different question about SNAP. Good morning, Director. Where is the state right now in terms of the SNAP waiver?
Okay, I'm going to assume, but I don't want to. We have 2 waivers. There's a healthy SNAP waiver.
Yeah, that's what I'm
Okay.
talking about. Sorry.
I figured. No, that's okay. So the healthy SNAP waiver started through an executive order signed by Governor Kehoe, and so that has been submitted, waivers work a little bit differently with USDA. I'm learning this as well. So you submit your initial plan to USDA, and they approve that initial plan, and then if you need to make changes and adjustments, they say, just create the final product that you end up with. So states submit that waiver request to basically get started working. So our path has been to look at other states who are implementing and have implemented and see what they are doing in terms of how are they defining which items in soda, candy, prepared desserts, how are they defining through regulation, who all is providing feedback, which items are the toughest to define, and may be cost more than it's worth for that restriction.
And that's essentially the question. I was just talking to some of our grocery stores and essentially saying, hey, there's going to be one person that's in charge of scanning all this stuff, and as new products come online, deciding if that's the milk chocolate or the dark chocolate or it has some nuts, so it's not going to be, it's covered. We keep going back to granola bars, right? Are granola bars going to be accepted under SNAP, or are they not? And so I guess that's where I want to see where you all are in terms of the language, and if you could share that with the committee, I'd appreciate that. And then ultimately, having an understanding, as obviously this is the Appropriations Committee, as to what this is costing the state. So do you have any ideas as to the fiscal impact of getting this up and running?
Yeah, absolutely. So right now, we've been talking to stakeholders, but we are getting ready to start a facilitated through the support of the foundations process of stakeholder feedback, all from everyone from business owners, convenience stores, grocers, to beverage associations, to individuals who use SNAP, advocates, organizations that focus on nutrition, the expertise of pediatricians in terms of childhood nutrition. And then we are going to look at having specific stakeholder sessions open to the public, open to everyone, that are gathering feedback and talking about options in terms of different lanes. One's implementation logistics, and so how much time does everyone need? What sort of education needs to happen in order for people to understand if you're receiving SNAP, what the requirements are, if you are the grocer, how to code your system, if you are the worker, how much time do you need for training, and then we need to back into the timeline. So October was the implementation date put in the executive order, but that can be adjusted as we get stakeholder feedback and find out what's the timeline is to get it right. The other stakeholder sessions will also focus on access and nutrition, so including other stakeholders such as local produce farmers markets, and how do we make sure that we identify where there might be food deserts. How do we apply this because we have the ability to do online shopping for groceries and food delivery for individuals who have the ability to use that in their area of the state. So how do you apply these requirements through Amazon grocery? It's
Okay.
called something different. I don't have it in my area, obviously, but that's at the current rate we're going to evaluate. There is a negligible cost to the state in the form of the states that have all implemented already. The plan is to have this be, there will be a cost to grocers and convenience stores in coding their system. So we want to get feedback and take that into account, because we want to be able to inform our legislative partners and the administration on what is the difference between that and getting estimates from all of the EBT card vendors who could do SNAP, and what would it cost to code in those requirements and keep them updated. So we want to be able to provide that level of information for everyone for decision making.
Okay. I appreciate that. So you're anticipating or possibly pushing back that October deadline?
At this point, based on what we said when we developed the executive order, that we were going to adjust based on what we had learned from other states in their implementation journey.
Yeah.
And I can say with a 99% level of certainty. It's taken longer than everyone has expected, and so
It's very complex.
yeah.
Absolutely. So I appreciate that, and hopefully, and that gives some certainty to obviously the grocers as well, that they'll have a little bit more time.
Yeah.
But again, so you said you're anticipating the cost to your department are nominal?
Correct.
Okay. Okay. Thank you.
Okay, that will take us to page 17. This is the new decision item for the GR pickup for the FMAP fund. The Enhanced FMAP Expansion Fund was created as a result of enhanced 5% earnings due to the temporary increase in the federal Medicaid assistance percentage. Earning receipts to this fund ended in September of 2023, and there's ongoing appropriations for this fund, and therefore, since revenues have stopped, we need appropriation authority to keep the essential services ongoing. Page 24, this is the new decision item for the FMAP adjustment. This is 134 million all funds, 15.9 million GR. Each year, CMS receives a percentage for Medicaid costs the federal government will reimburse each state. FMAP varies by state and is based on criteria such as per capita income. This year, our percentage went down. For reference, last year's NDI was 59.8 million, total 46 million GR. Okay, that takes us to page 53. This is the NDI for OA ITSD transfer cost to continue. This is request for additional non-count authority that is needed in order to align our appropriations with expected expenditures. This is the mechanism for us to get our federal funds to OA ITSD. It's all federal. Page 61 is the new decision item for the citizen engagement platform, $4 million all funds, $1.4 million GR. This was a new appropriation FY26. This platform will streamline and enhance the Medicaid process, which will provide citizen transparency and two-way communication for efficient application processing and data collection. The citizen engagement platform is something that will be deployed inside the Family Service Division. It'll be the base portal that we'll continue to build off of for our HR1 requirements. The goal of the platform is to have a one-stop shop for our ability for our citizens to apply for Medicaid and SNAP and streamline integrations between the portal to the systems that our caseworkers use. Page 63, this is the new decision item for the DSS Health Data Domain. It's $1.4 million GR. Data is a huge component of the HR1 strategy, so this would begin the funding strategy to ensure that we are creating the necessary assessments and the infrastructure to make sure that the provisions of how we administer data between the Department of Mental Health, Department of Health and Senior Services, and the Department of Social Services, which all administer different forms of Medicaid. Medicaid in Missouri is siloed, and this starts a foundation for sharing data. We will have a way to share the data faster, easier, and better.
Okay, I do have a question on this one. As we look through a lot of the IT stuff, I see federal match in the majority of it. And I know I'm looking at 1.4 million, but no federal match in this, and it may have been discussed with me earlier and I've forgotten that.
I don't think we hit on this one. So we put the new in, if we don't have an approved 90-10 match from Medicaid yet, we put it in as a general revenue request, and then we go to CMS to apply for that 90-10 funding, and we'll adjust in the budget as necessary.
Okay. I heard that word adjust if we get approved, right?
Yeah.
Okay, that takes us to page 98. This is the new decision item for the provider enrollment unit. This is $17.9 million, all funds, 5.2 million GR. As part of the department's modernization of the legacy MMIS, MMAC is pursuing a provider services module that will allow for more automation of the provider enrollment, screening, and monitoring functions. This program was funded partially as a one-time appropriation FY26. That is why you see this NDI. However, the project is up and running. The project kickoff meeting occurred in July of 2025 and crosses 2 fiscal years. Okay, that takes us to page 142. This is the new decision item for Receipts and Disbursements Authority. This is $1.1 million, all federal funds. We had funds that did not appropriate FY26 budget authority. This NDI is to add those 3 funds if we have refunds that need to be deposited into the same account as the expenditures come from. This is all non-count authority. And you can see those funds listed on page 144 if you're interested. Page 151, this is the new decision item for the county detention payments cost to continue. It's $152,000 all GR. These payments are required by statute. This NDI is needed for additional authority in this section for a combination of a rate increase that was appropriated in FY23, additional county participation, and also the timing of bills that a county or two has not previously been sending in timely. And that takes us to the end of the supports book.
We had a question. Let's go to, before we flip books, 181 and 182. Legal service. Why did the permanency court Title 4E reimbursement section not expend any appropriated funds? So 182, right, is where we're looking at that chart.
We'll have the director of DLS come up and explain that one.
Okay.
Hi, good
It looks
afternoon.
like, looking at that chart, there's been no funds expended out of this, and
That's correct. So I'm Terry Armstead, the Director of Division of Legal Services, and this is a pass-through amount. So currently Missouri is a county-based for their legal representation for children and parent attorneys, and so we have to contract with each of the counties if they want to expand their legal representation. And then they have the ability under the Title 4E to draw down those funds. So these are federal dollars that we could pass through to counties. Right now we have one county, Jackson County, that is contracted with us to expand their legal representation for parents. But that is what that fund is for.
okay. So Jackson County they've not made it to the point where they could ask to draw down any funds. They're preparing to do that.
That's correct. We've had a contract with them for a little over a year. They took some time to hire some additional attorneys, but they're at the point where now they would be invoicing to be able to draw down those dollars.
Okay, and I don't know, of course, all the background, how this fund was generated, but it would seem to me there'd be more counties with the difficulties we discuss about children and taking care of them. There'd be more counties looking at this. You think it's something that's very widely known in our state or not? I don't know who to point. I mean, we're not going to pay for TV commercials for it, but
Sure. We've done a lot of work with our partnership with the Office of State Court Administrators to be able to work
Okay.
with counties. I think some of the administrative burdens on drawing down these dollars have created some barriers for some of our smaller circuits who just don't have the staffing or capacity to really look into this program more.
with those barriers, with the people that you could give me that's looked at this, would they blame the state for the barriers? They'd probably blame the state, but are those barriers state generated or federal generated if you had to put it in a column?
Sure. I think they would likely be some of the federal requirements and documentation needed to be able to invoice those dollars to the state. We've been working to affect contracts that are more simple, but still the county has to be the one to manage and survive any type of audit that they would have.
Okay, well, thank you for helping explain that to me. Thank you to the committee for letting me to chase $600,000.
Okay, that
Book
takes
two.
us to Book 2 of 7, the Family Support Division. We'll start on page 207. This is a new decision item for the additional staffing request. This is $9.2 million, all funds, $2.3 million of that is GR. Additional contracted staffing to process the annual renewal backlog for the family Medicaid to ensure renewals are current prior to January 1, 2027. This request for additional staffing is critical to meet the current annual renew processing prior to the upcoming policy change as outlined in HR 1. Currently, every case is required to have an annual review. However, with HR 1, it increases to every 6 months for AEG cases, and as a result, this will double our renewal workload for AEG on top of the current annual renewals already required for all Medicaid cases.
And just for reference, on the one-pagers, specifically the Medicaid error rate, but you can also see it on the SNAP error rate, this is directly tied to our ability to keep up and be on time with Medicaid annual renewals. And in the past, the state has made some cuts in the Family Support Division staff to where we have not been able to keep up with that, and that was enhanced as an issue when the adult expansion group became a population and there were no additional Family Support Division staff added to process those eligibility renewals. And with the, you can see on the one pager for the Medicaid payment error rate, they look specifically at have you processed the renewals on time. Missouri's 2019 Medicaid audit found a disallowance of over $1 billion for just directly around not having eligibility renewals done, and that problem has been amplified with the adult expansion group. So we are putting in place the technology options that we've talked about in order to get to a more automated process and not have as many, need as many people, because the cost of hiring people and the ability to hire staff to process eligibility is very challenging. So while we do that though, because the audit for when this Medicaid error rate will go into effect for financial impact, because it starts on July 1st of this year, we are asking additional partners within the state to come in and assist us with processing annual eligibility renewals, and that includes the FQHCs locally, as well as some hospital and CCBHO partners. So we want to partner with our existing providers to provide another source of revenue stream for them as they hit tough times, but knowing in those conversations that this will have fade away as we implement the technology and get a more automated process. States that are solving the work requirement and the every 6-month renewals that are roughly the same size as us have asked for 500 new FTE in their budgets, and that is not something that we felt responsible, would be a responsible ask, and quite frankly would be very challenging to even be successful due to the state's ability to hire in the job classification of benefits program specialists, the staff that do the eligibility for Medicaid and SNAP. Although I will just give a thank you to everyone's support for the time of service pay plan, because that's made a major impact for specifically our family support eligibility workers and for our children's division staff. Many of them had been at the agency for nearly 20 years and had been a part of that 17-year stretch with no cost of living increases. And I might know a lot about that because we were all here during that time too. So if you stayed in your position and you became an experienced children's worker or an experienced eligibility processor, that is invaluable. You can mentor and train other staff, but there was no incentive to stay. And we see those staff starting to stay and our retention rates increasing. So appreciate that. Sorry.
Okay. That takes us to page 355. This is the new decision item for Save Our Sons. This is $250,000 TANF. This funding is, 355. We're on book 2 of 7. 2 of 7, yep. Save Our Sons, $250,000 TANF. This funding is to support the expansion of Save Our Sons and Sisters. The Save Our Sons and Sisters program helps participants in understanding how to become employed, get promoted, and remain marketable in the workforce. In the Walnut Park area, unemployment exceeds 28%, and the proposed collaboration aims to help reduce this number through unified efforts between Urban League and the Sakufa Unity Center.
Okay, we took a big enough jump. I've got a couple questions in between where we were at and 355. So on page 296, if anybody wants to go there, the famous system. Well, this technology stuff takes a lot of our time, doesn't it? Yeah. What is the current timeline for DSS? Don't do that, Director. What is the current timeline for DSS to move the remaining programs from Famous to Metis?
I'm gonna,
As close as you can.
I'm gonna bring up our CIO to answer that question, because as much as I would like to say that's a simple answer, it is not.
I thought that might be true.
Good morning.
morning.
So I will talk a little bit about Famous. So Famous is currently under the process where we have been partnering with CMS beginning probably, I would say, April, May, to talk about an evaluation. We haven't done a feasibility and landscape assessment on our eligibility systems for over 15 years. There's been some new changes at the federal level around advanced planning documents, which is how you unlock your enhanced federal participation match rate for your systems. So I'm trying to, so it's basically the 90-10 or the 75-25 or whatever match rate you have for your system. So those changes came this year. They went into effect in January. All of our current documents that we supply for 90-10 have to be updated by the end of this, basically our fiscal year. So July 1, we have to submit all new documentation. Our fiscal year, yep, state fiscal year. We have to submit those and update those. One of the conversation points that CMS has had very strongly with us is that there is a huge focus on getting the non-Magi and the Magi program into one eligibility system. So there's been a strong push.
I'm going to break in and get your acronyms
Yep.
for you. So modified adjusted gross income is MAGI. So in the Famous system, you have non-MAGI, which just means that you take into account more than income for their Medicaid eligibility. This would be including our age blind and disabled population, where we look at the assets for individuals, and then your MAGI population, modified adjusted gross income, that is who is currently in the Metis system, and that is where you're looking at income only.
So what they're looking for is CMS has had, and it's probably been a couple years, I won't quote the exact date, but for a couple years they have pushed states for what's called integrated eligibility. They want to see systems where you have integrated eligibility with Medicaid, which would basically just mean you want to have in one eligibility system both the MAGI program and the non-MAGI. So what we are currently doing right now is we'll be releasing a contract shortly to do a full assessment on our eligibility enrollment systems in the state of Missouri for DSS. So that will include Metis, Famous. We do have an older system called Legacy. It's a legacy Cobalt system that also still supports some pieces of what we do inside of Famous. All of those systems will be evaluated to then look at what is a proposed plan that we can work through and talk with CMS to get to what they are going to require in the future, which is called integrated eligibility and a single system that has that process. So current state right now, we are talking not only to the USDA, but also CMS to talk about and begin that feasibility and landscape assessment. And they are also asking for it's not newer, but it's a alternative analysis assessment, and that now includes comparing other states with similar populations in your Medicaid size, similar populations in how you administer these programs. Like, for example, if you have caseworkers that are doing the eligibility processing for both SNAP and Medicaid, they want you to do alternative analysis and look at how they integrated their systems. So we are kicking off that process, and I would say probably the next 3 to 4 weeks, and starting to look at where we're at with that. So I wouldn't have a final determination to say when. I think we will have to complete that alternatives analysis as well as the feasibility and landscape assessment to then define the finalized pathway of where the eligibility and enrollment modernization needs to go.
Don't leave, because we're staying right in
Okay.
here at these. And
Okay.
I need somebody with more, I think you've been to the department, not a tremendous amount of time, right,
Yep.
history, and this is probably somebody that's retired. As we've chased, I'm gonna say chase, probably the wrong word, all these changes that happen from the federal government, I guess somebody that out there retired to decide this is what to do this morning, tell me if we ever caught up, if we ever ended up where the federal government, or they started changing it about the time we made it to where they wanted us to be. That's not an answer, it's a stupid comment. Also, right in that section, right, we go to page 308, 314, this just continues through there, and I think you answered a piece of this, okay? I just want you to pull it back out. Since Family Support Division has decided to keep SNAP and TANF in famous at this point, for the time being, are the appropriations for SNAP and TANF in the METIS section still needed?
Let me look. So, can you give me page reference? Because I just want to make sure.
Yes,
308. Okay.
308 and 314 is what, and you know I get my help, right?
Sure. So this is, I'm going to go with yes. So some of the work that we're doing with HR1 is, because you have two core eligibility systems, is we are trying to improve how we do enterprise content management. So as you can imagine, if somebody is applying for SNAP or Medicaid or TANF, there's a lot of supporting documentation that comes through. So what we are trying to do is implement, because METIS is newer, and it's I don't want to say easier to update, but it is a little bit more modern to update. We are trying to implement things where there's pass-throughs between METIS and FAMOUS to update and take some stress off of the FAMOUS system. So those two different line items will help us continue to implement efficiencies across METIS and FAMOUS to improve those workflows that we've identified with HR1. So like, for example, there is an API integration. It's just a fancy way of saying, fancy way of just saying, I'll take care of it. So it's a fancy way of saying you are sending a real-time data feed. So a lot of what you see at the state is called batch integrations. It's a point in time, basically sending one piece of data at midnight and then waiting the next day until midnight to send the next piece of data. So as you can imagine, we run, things update very, very frequently. So what we are trying to do is doing improvements with SNAP based on the error rate fiscal implications, is to do updates to make more real-time data exchanges for SNAP and TANF. We have found that it is easier to take off some of the burden off of FAMOUS to do some of those pass-through updates with METIS. So I hope that makes sense, but those are some of the things that we're trying to do.
Toy, do you mind if I add, there are, we talk about, this is not a handout that you have, but it's more of it's on our website, and I can send the link. It's section by section of HR1 and the changes in the SNAP Medicaid programs. And I will tell you, some of these changes that are live data feeds are not mentioned on the overview, because how detailed can you get on this level of an overview? But there are, is a required match starting on January 1st, 2027 to check the Social Security Administration's death master file. So previously we checked vital records in Missouri for death certificates. There's a new requirement that in order for your system to remain certified, you have to check that master file. Another example is that we check the SAVE system, which is ensuring that someone has a legal status to be in the United States. We check that manually with each case, and that will need to become a interface where we automatically check that real time. Then you can get down to some very detailed and fun ones that include recalculations in the amount and who is eligible for utility reductions based on their eligibility for another program called Low Income Heating, Energy, and Assistance Program. So pages and pages of sections of changes that are all about data feed updates. And so hopefully that's helpful and not more confusing.
And the other thing I wanted to add is we spent a lot of time, so as we were planning, just to give like a foundation, when this first came out, the first month was really spent in July, like assessing what a 937-page bill that affects Medicaid and SNAP, like what are all the core requirements? What does this actually mean for our systems? Then we went heavily into August, September, October, and really working where we pulled technology, the technology and system teams together with our policy and our field staff teams. Some of the first things that we wanted to make sure for provisions is that Medicaid work requirements are critical. All of these other, I don't want to call them smaller because they still are substantial changes, right? But all these other system changes we knew we needed to map out. But I think the biggest concern we had is that for states like Missouri, who are already behind in processing eligibility, if we didn't ensure our plan concluded substantial changes into the workflow of how a citizen processes through and how a caseworker is able to successfully check eligibility, we had no way to penetrate the error rates. So our design has been multi-tenant. So we pulled the FAMOUS team, the METIS team, outside contractors that we've been working with. We've actually had multiple, like probably close to 10 almost all-day sessions, pulling in every single vendor, every single component to really map out what does the citizen journey need to be with this. And I'm a nurse by background, but I look at behavioral analysis. The easier that we can guide a citizen through this process and able to help them give us the correct information through these systems, the better our ability is to get correct and accurate data, which will help us then flow that, and then the technology can be used as an instrument to improve our ability to have a quality outcome on how we are checking income or verifying their eligibility, which is really the whole proponent of the error rate and where your penalty is going to come in. So we've been really challenging and they've really rised up to the occasion, but we've been challenging our eligibility teams who are already at current state. It takes a lot to run those systems and keep them solid and keep them stable. We are challenging them to work together to reduce the amount of work. So some of these line items are really challenging to say, okay, if we can build it in METIS, pass it through to FAMOUS, vice versa, whatever is going to reduce the stress on the current eligibility system, that's what we're truly trying to push the teams, and then making sure we have an integrated approach with our policy and field staff team to say, okay, are these system changes, what are they going to impact? Because we don't want to make a change that is going to cause an increase to their processing inefficiencies and or a risk that they're going to process the income or the verification, which would then downstream impact the quality.
One more question there. I'm
Sure.
listening to this. A tremendous amount of this work and these questions, they're being generated around HR1. And I think the majority of us want to make sure that error rate is lowered. It's the timelines put on us that's putting a big pinch, correct?
Yes.
So my next question is part of that pinch. On 319, where we're looking to procure the contractor for METIS independent validation verification. Is there a timeline already generated with that at this point?
Yes, so we can share our timelines for implementation. So we're working through, and I mentioned this a little bit when we were talking in supplemental. So we have aggressive use case development, and in our APDs, we've submitted our overarching timelines for procuring and implementing. We'll be working with, actually, I think it's the 31st of this month, we'll be sitting down with the METIS and FAMOUS teams to then start to work through the release timelines
Okay.
for what we call, so I have two buckets. So I want to explain this to you. How we're working this is two work streams. So you have bucket one, which is your system enhancements. How we're really approaching this is for system enhancements due to, for example, the checking of the death master file. We're sitting down with that team. We're having policy create the user story and field. Then once the user story is done, we make our assumptions for our federal partners.
Can you, I just want to level set and make sure everybody knows on a user story, that is the planning that needs to take place in technology where you walk through from every type of citizen that could apply for eligibility in SNAP and Medicaid, including what variations in household they might have. Are they dual eligible for both Medicaid and SNAP? Do they have someone who lives within their home and rents from them? Do they have 2 to 3 sources of income or just one? So all of those things, they have seasonal work. All of those things feed into developing all these user stories so that at go live, we are able to make sure the system works for everybody who might apply.
So the user story is kind of like, I think about it as like you're taking somebody and saying, okay, could they have income on a W-2 only? Do they have income and they have gig economy work and they work at Uber? So it's going through every single type, trying to basically pre-anticipate any different scenario that if we need to check for work requirements, let me just give the example with AAG work requirements, then we're working through and really understand all the different scenario types because your systems at the base have, like Medicine Famous, have business rules engines. And those business rule engines, think of it as just a fancy way of it's checks to make sure that they are following the program rules and we are not allowing somebody to pass through and it's following the provisions of basically the guidance of the policy and program rules. So that work stream lane is full running and we are working on our different release timelines. So when you're in for these 2 systems, Medicine Famous, we're in called what's maintenance and operations. So you're at the point where they're up, they're running, all you're doing is maintaining and doing enhancements to meet the biggest business and program needs. So you kind of have a massive bucket of those, is how I'll say that. And then you have another massive bucket, and that other massive bucket is what I call new features that either have new modules that either have to be built, new platforms that have to be integrated, or brand new data sources that need to be shared across multiple systems. And so that timeline and frame is what we had been working with CMS to say, okay, here's where we want to meet. Here's based on the guidelines of what your deadline, which is the January 1 of 2027 for most of these major items. Here's how we're working back. And so that's why we put our APD in November, got our approvals in early January. We're now working on, in partnership with our legislator, the general revenue match to be able to proceed forward, and then we'll work to issue contracts, and then we have our aggressive timelines built in with all of those teams to implement those pieces. But we will have like a release plan on the other items that we are working with our current PMO team and this IVNB team oversights to make sure that we have quality, a quality output.
Thanks, Toy. I want to let everybody know that we very much respect the legislative process and are requesting GR for these items, but it is just that. It is a request, and it's our responsibility. And I think as being in state government for so long, you can wait until you have the appropriation to start planning, or you can start planning and be ready to go as soon as the appropriation is given to you. And that's the path that I choose. If we end up doing work that is not needed because of a different path chosen by our legislative partners, then we go there. But I don't want to be in a situation where we sit around and just wait and say, well, we couldn't do anything because we didn't have an appropriation until, because it only happens once a year. So that's just something I want to make clear.
Okay, committee, my goal is, this is the last question for me around IT. Because I know we're sitting in front of the Department of Social Services, so at the end of this, the director or somebody's going to say, we're still in the business of helping people, but we spend an awful lot of time talking about IT, and somebody's got to say on a microphone how that helps people at the end. So I'm planning on this being my last IT question, because I don't understand it, right? Trash 80's where I started, and I decided not to do what you did. I stayed in the trash 80 column, if you don't even know what that means. But I was pretty fancy with that floppy disk when I started in the early 80s. I'm going to say you, and you means the department.
Yeah.
have talked about these systems and what you're doing, and it sounds to me like it's somewhat somewhat siloed within the department. I'm asking a question, not to do gotcha with you or anybody else, but it seems like you're helping put this together, your department's putting this together. Is it inside OAIT or are you outside OAIT doing this work? Or is it some kind of a blend? And do that as short as you can. I think it's a pretty direct question.
You're in a blended family situation. Mo Health Net Division is an unconsolidated portion of the state, and the rest of the department is in consolidated IT. So this has to be a hand-in-hand partnership, but with a more enhanced level of planning and responsibility on the department because of Medicaid being a carved-out piece of consolidated IT currently.
I also just want to add, I think the other unique, so Director Bax brought me on, so I've been in healthcare my whole career and whole life, and technology, data, and informatics. There is a huge piece that I think she was hoping to bridge the gap with the team, is that it is a different lens to think about the actual clinical workflow, and this is social care, it's healthcare, it's all those components. When you look at healthcare IT, it is different than just standard IT. So what we're trying to do is really take a step back and get some subject matter expertise in the department that really understands these programs. So I understand these programs. I've been in hospitals. I've been in, most of the downstream provider areas. So maneuvering those together is a more solid approach to be able to make sure that what we're administering and the things that we're looking at are going to serve the program, but also leaning in and having that partnership between technology experts and internal technology experts is going to help us to be more effective.
I'll do my best. No more IT questions.
Okay, thank you.
Sorry for the holdup.
Okay, that takes us to page 357. Convoy of Hope. This is $2 million GR, added as the governor's recommended item. This is funding to address food security needs through the purchase of Missouri-grown rice. Convoy of Hope is establishing a food manufacturing and packing center. When fully operational, the facility will produce up to 1 billion meals each year, allowing Convoy to respond rapidly to crisis and meet the needs of growing domestic and worldwide programs. Page 378, this is the new decision item for Prosperity. This is $1.9 million all funds, $995,000 of that is GR. Founded in 2016, Prosperity is the nation's only nonprofit pet grooming school headquartered in Kansas City with a mission of breaking the cycle of generational poverty. They provide hands-on training, wraparound support services, and sustainable career pathways in the pet care industry. The purpose of this NDI is to support an expansion into St. Louis. The impact on St. Louis within 3 years, they project 66 graduates in year 3 trained in high-demand grooming and pet care centers, continued job placement success with 85% or higher placement rate, an estimated 107 Missouri families lifted from poverty through education, employment, and wraparound support.
Senator Nerman.
I want to jump into these NDIs real quickly, but appreciate all your questions on IT. I think they're well merited, and they're still. We talked yesterday quite a bit with, and I look forward to continue those conversations. But I'm going to have them offline just because I'm trying to wrap my brain around all of it, and there's a lot there. But on these, as we get into kind of the smaller dollar items now, I think still merit conversation as well. On the going back to the Convoy of Hope, is this for? When I look at this, it looks like this is the purpose of feeding the world. None of those dollars are spent here in Missouri?
The dollars will all be spent in Missouri. So the
For
form.
the purpose of working to feed the world through children's feeding initiatives. Okay.
Yeah. So there was not a lot of information in the actual form, so we can provide follow-up information, but in the actual budget book, there is a very limited amount of information.
Okay. Yeah, I would certainly like some more information. I just want to make sure, obviously, we have a lot of kids living in food insecure homes. I want to make sure that these dollars are being spent here. Just when I looked at that, it seemed like they had more of an international mission. Okay, so if you all can follow up, obviously we need to make sure that dollars are spent here when we have, some communities where 1 in 5 kids live in food insecure homes. I want to make sure those are here. And then looking at prosperity, this is another one that I think merits some scrutiny. When I went through and I was looking at this, and again, I'm not saying that these aren't worthwhile organizations, right? I've seen them, really cool stuff that's happening in these different groups. But again, we're looking at dwindling resources. So when we look at GR, when we look at our TANF dollars, when I look at prosperity, and I guess honestly this is just for the edification of the committee, the mean salary of a pet groomer is $32,000 a year. So when the goal is to overcome generational poverty, that's a pretty lofty goal when we're training people for salaries that are $32,000 a year. I'm not quite sure how you overcome generational poverty with that salary. Again, it's a cool program. I think I've been there. I'm sure others have been there as well. But I look at programs like then Annie Malone on page 420, where the economic mobility program, I think this merits the $2 million. If we have to, I hate to say this, but it is going to be up to the committee to start picking winners and losers in these things in terms of who's going to get these state dollars. And I just want to throw that out there for the committee to really look at these as to which organizations we're going to be supporting. Thank you.
Senator Washington.
Thank you. I definitely don't want to dispute with my favorite senator from Clay, but while $32,000 doesn't seem like it's going to lift some out of poverty, many of the students at Prosperity are overcoming homelessness. They are on 100% government aid, so that $32,000 still helps them. Many are single mothers, so even with $32,000, some of them are still able to get Medicaid for their families, maybe rental assistance. But the biggest thing it does is non-financial, and that is it gives them pride that they have a job. And many of them, it leads to further education. And so the allocation here, the recommendation, is not just for the Kansas City program, but because of the success of Prosperity, it is to expand this great idea to the St. Louis area. So I just want to, it is in my district, and I want to show, I just want it to be known what it does, and what, for those of us who maybe didn't grow up on those type of programs, we sometimes are blinded to what really might help a poor person. And I can tell you that $16 an hour is welcomed by those who, prior to our minimum wage state increase, were, 5 years ago, were happy to get a job for $7.50 or $7.75 an hour. So Prosperity does have its place, and also it attracts those who may not be able to. When I went, one of the things that I talked about, and we're still trying to work on, is tying that into a vet tech program at our community colleges. Some of those young people are not able to get to that science part yet, but after going through the Prosperity program, they're in a much better position to further their education in other areas of animal health. So I just kind of want to throw that out there. Thanks.
Thank you. Go on.
Okay. Takes us to page 468. This is the new decision item for the blind pension rate increase. The recommended appropriation is a little over $1 million, all other funds, which is the blind pension fund. This funding is used for a monthly rate increase for the blind pension recipients of $32 per month would be the increase. FSD is statutorily required to provide the requested increase for consideration, but the rate increase is not required to be passed by the General Assembly. Takes us to page 505. This is the new decision item for child support reimbursement to counties. This is $2.4 million, all other funds, which is the Child Support Enforcement Fund. The governor recommended $2.4 million of the child support enforcement reimbursement to counties, which reimburses counties in the city of St. Louis for the child support related expenses to offset general revenue used to support the Family Support Division.
I do have a question here. It talks about on page 506, the GR reduction, and it may be in the paperwork that you provided us. Again, where is that GR reduction at around this item? Is that something you can tell me?
So it would be in this section, when budget plan did governor's recommendation, they didn't core reduce it because we would be coming back for an NDI for a pickup next year. So instead, they directed that the agency would be putting it in agency reserves in SAM2, like our financial system, not to spend it.
Okay. Thank you. I do understand that. Not,
Okay.
didn't have big IT, I mean, punch cards. If we go back to punch cards, I could help.
Before we leave this book, I do want to go to page 514. That's a core item, not a new decision item, but this is for a transfer in from Department of Revenue. So this is new for FY27. This is to bring the Family Support Payment Center from Department of Revenue over to Department of Social Services. It's $5 million, all federal and other funds, 2.62 FTE. Okay. We'll move us to book 3, which is the Office of Workforce and Community Initiatives book. We're going to start with an NDI that did not get connected in movers correctly, so therefore was not in the book printed and bound. It's going to be between pages 666 and 667. It's for the Great Jobs KC. I believe your fantastic Santa Pro staff has put that in your books. That's $250,000, all federal funds. This is TANF. This is for Great Jobs KC for the purpose of assisting individuals in obtaining post-secondary education and job training. And if there's no questions on that, we'll go to 679. This is the new decision item for Save Our Streets. This is $500,000 GR. The governor recommends appropriating $500,000 to Save Our Streets for the purpose of providing conflict mediation and connecting neighbors with viable resources and services to reduce crime, violence, and improve the quality of life. Page 686, this is the new decision item for Boys and Girls Club of Heartland. This is to increase after-school and summer program services. This is a reappropriation of one-time program that was funded in FY26. Takes us to page 789. This is the new decision item for the 57 Foundation. This is $250,000 all funds, $125,000 is GR, $125,000 is TANF. The 57 Foundation for the purpose of providing essential resources and support to Missourians who cannot adequately help themselves. 57 Foundation is a nonprofit, nonpartisan organization. This funding will help provide financial assistance to Missourians struggling to make ends meet due to unexpected, unforeseen, and difficult circumstances.
And this is another item where there was not a lot of information in the book, but there is a follow-up information provided by OA and the governor's office to the department that we can share after this.
Senator Nuremberg.
Thank you. Yes, I would love to see that information. Obviously, this is Governor Parsons Foundation. Really interested to see what work they've been doing or what they anticipate to do if the state appropriates these dollars. I want to go back to another group that's in here. When we look at the alternatives for abortion line items, that's a lot of money there. Can we get a list of the organizations that receive funding through this line? Okay.
Absolutely.
Thank you.
814, page 814, VOCA. How much VOCA funding does DSS expect to receive in 2027?
I have the director of OWCI come up
Because
and
my
help with
understanding has
VOCA.
been changes moving primarily down from the federal level in VOCA funding. So I would, sorry about bringing it up here, that, but I think it'd be good to hear it because I've certainly been hearing questions about it in my office.
Yeah, so Jerry and Yeager's Brennicky, Office of Workforce and Community Initiatives. We don't receive final allocations on VOCA for the same federal fiscal year until like July of the next year, so we really don't know for sure. And it's hard to tell at the federal level because a couple of years ago, there was supposed to be the big fix put in, right? And then the payments didn't come in the way they thought they were going to come in. Over the last few years, it's been around 20 to 24 million dollars. We do have, and we've had about $49 million total between contracts and admin. So it roughly half of probably what we need.
And this is all based on
What we could spend.
settlements, correct?
Yeah.
Right, it's all based on fines and fees and settlements and how much prosecution and cases, and that fund has gone
And
up
this
and
is
down.
Part of what you're discussing is federal level.
Yes,
Not
this
at
is
state
federal.
level for people listening in. Part of that's federal. Now, what about the discussion in my office within the last couple of weeks about there is some bill moving around at the federal level? I was told that might go back to stabilizing these funds. Is that anything you know about, or is that somebody?
So we do watch the legislation. It's hard to really say what'll shake out of it because we watch the legislation on a regular basis at the federal level. We thought there was going to be a fix last year, right? We thought everybody was going to get increased last year. We thought that was the year before, and it's really hard to say what's going to happen.
Yeah, okay, so that, obviously, a group probably hoping that the legislation, I think you're saying to me, has been filed over and over again.
Yeah, they're
Things to
trying.
At the federal level, and someday it might happen, someday it might, probably not today.
Yes, they have been trying to utilize different funding sources to stabilize the VOCA fund at the federal level.
Thank you.
Okay. That takes us to book 4 of 7 for the Children's Division. We'll stop real quickly on page 826. This governor's recommendation shows 0, but I wanted to let the committee know that it has been handled with reallocations instead of the NDI, and so the department is good with the way to proceed with this. So 897 is the first NDI we're going to talk about for Children's Division. This is the CWIS cost to continue. It's $10.8 million, all funds, $6.3 million GR. This request is to support the build of a new comprehensive child welfare information system. CD's current system FACES is built in a way that makes it difficult for CD to enhance and incorporate new functionality. The department is anticipating the RFP and/or contract to be released in FY26. The governor's recommended amount is what DSS projects to be the need for the first year in FY27.
This is one where I think in the past you've seen a request and you've not seen funding be spent. And that was prior to me, but also during my time here since last January. When I arrived, we looked at the amount of projects that were going on in the Department of Social Services, and we stopped counting at 39 IT projects. And we took a step back, reprioritized, and made sure that there was a number of projects that could be successful. Everything's a priority, nothing's a priority, so we worked with our partners in ITSD. This is an example where early on we had been hearing that states who started implementing have not been successful in getting certification from the federal government, therefore their federal match from the Administration for Children and Families. We're starting to see that change, and ACF just opened up a technical assistance center for this. So the delay is a very good thing in this time. We don't want to start something that we can't be successful with. So now that we have more information and we've seen 1 or 2 states start to be successful, we'll be ready to begin.
That was the only NDI in Children's Division, so if there's no questions for Children's Division, we'll move on to the next book. Okay.
1084, if I can get my microphone to come on. Besides the line-out appropriation for the Adoption Resource Center in Cape Girardeau, did they receive any funding from the appropriations given to one of the three nonprofit FRC agencies? Book 4, 1067. Did they receive money somewhere else from some other source with this?
I'm going to have our Children's Division team come up.
Okay. I'm asking similar thing on 1079 with the Wright County one as well, both of these.
Good morning. I'm not aware of them receiving any funding besides what's allocated
Okay.
on their line items
All right,
for both.
thank you.
You're welcome.
Senator Norbert?
While you all are up here on Children's Division, I talked briefly with the director yesterday, but can you all just talk to us, just high level, where are we in terms of vacancies right now within Children's Division, some of the things you all have been doing in the last year to improve retention within the department? Where you plan to go from here?
Sure. Good morning, Senator. Thank you for the question. We have really been leaning into, and I believe Director Bax had provided a little bit around our specialized teams. And so over the last year, we've been looking at where our specialties are within the division because we really see more retention. Children's Division is massive, just like a lot of our different programs throughout the department. And people, you have the very beginning hotline call all the way through kids that are in care. And so when you feel confident in a program area, instead of learning all program areas, we've seen our retention and those specific areas really stabilize those pieces. So we have our Royals unit that works with our older youth and some really good outcomes around that. In January, the 13th, I believe, we brought up our critical investigations unit, and they investigate fatalities and near fatalities of children in serious incidents. And those are a specialized team that the goal is to take those off of the front line. And so previously, before that, when those would come in, a new worker could be on call. And that's a really hard thing for anybody, even the critical investigations unit, to investigate the death of a child. And so this team takes those, and so that front line won't have those. And so there are several different specializations that we're leaning into. We're working with our regional directors and our program teams to see what other groups that we need to bring up to help with that retention piece. We have seen turnover lessen over the last year projected. I think we're at 6% less than last year, that's a lot, but we still have some work to do.
So
Senator.
you're 6% less, so what is the turnover rate?
So our FY25 turnover for Children's Division, and these would be our front line, so 1 through 4, was at FY25, 40%, and year-to-date, 34%, which is
Still
large.
substantial, yeah.
And
Okay.
we actually,
And
oh, sorry.
Yeah, and I'm sorry if I missed this at the beginning too. Do you all have the pay scale with you, or can you follow
Yes.
up with the committee to make sure that that's dispersed? So a frontline worker, what's starting salary in Children's Division?
So frontline team member has a starting salary of about $44,000.
So we're starting at 44.
And then we go up from there to 48, then 51, and then our children's service worker 4s are at 55. And so average is around 50 because most are at the level 2.
Okay. And I know every year this is something that I look at because it is concerning to me. I think these are the toughest jobs in state government. When you talk about investigating the death of children, I mean, all of the things that they're tasked with, I can't even begin to comprehend their realities. And I know while we've made some substantial gains here, we're still talking about starting salaries of 44. Do you know just off the top of your head what a starting worker would make in Children's Division in the state of Illinois or in Kansas?
We do have that information. We have pulled it for the House, so we can make sure and get that to you.
Okay.
And thank you for recognizing that, the hard work of the teams. It's something that, we've been going around to different regions and really talking with our circuit managers, because actually when you look at 40% and you drill down, when we pulled that out by team members, it was around 440 team members in a year. That's huge. That's a third of our frontline workforce. So if we have around 1,500 frontline team members and you're turning that over, our training team is continually working through that. So that's something that we recognize, and we're working to, see what we can do with these specialized positions and more training to make sure that we're slowing that down and really keeping and pouring into our frontline.
Well, I appreciate that. And I think having those, we talk about it in teaching, it was having that shoulder coach next to you who could help you when you didn't know what to do. Having those specialized positions, the people on call to say, should I be concerned here? What do I do next? I think that's incredibly important. But still, we have got to reduce these numbers. That is just incredible turnover, and how much, again, resources are going into training, recruiting new folks, and then they leave in a short amount of time. So hopefully we can continue to do here. And then again, I'm going to say this just to my committee members, but we're talking starting salary here of $44,000. We have NDIs out there for a communication specialist for the treasurer's office for $70K starting. So I think that's just something for us to be aware of. Okay, thank you.
Thank you, ma'am.
Thank you.
Okay, Book 5 is a Division of Youth Services. We didn't have any NDIs for that division. So if we're good, we'll move to Medicaid. Oh,
Senator Burns?
Tell you what, it's education and issues concerning children and families that I'm always most concerned about. In terms of youth services, last year, I think all of us on the committee remember when we had some questions about kids in care. Can you share with us where we are today in terms of kids who are in the care of the state and we don't know where they are? Do we have a number of kids who are missing?
So I'm going to have Matt join us up here. He is the director of our statewide team that works in specialized law enforcement for children's division.
And then he might be the person who can answer this too. So I have a question about that, as well as kids who are sent out of the state and the costs that are incurred for those kiddos as well. And the initiatives by the department to be able to keep more kids in the state of Missouri. And again, these are kids with complex medical needs often, lots of complex issues that aren't treated here, but also incur a lot of cost. Okay.
Yeah.
If you can speak to those two issues.
We'll speak to the kids who are not in the location that is approved by the court first, and then move into out-of-state placement for youth in the state's care. So we put the numbers yesterday, and we have 28,
27 is out.
27.
Okay.
38 youth who are not in court-approved placements locations.
Okay.
That's the daily run report.
Okay. Yeah, so my name is Matt Lindemeyer. I'm the director of the State Technical Assistance Team. We're kind of a multifaceted agency under the umbrella of DSS. We have a law enforcement unit to support all things crimes against children across the state of Missouri. So I know the last poll that we had on our last calendar year report that we had done, I think the recovery level was somewhere around 589 that had been recovered throughout the entire year in cooperation with our partners at Children's Division. Now it also accounts for some of the, what we would call chronic run children who were placed.
So
We put them back
just
and they run
clarifying.
again.
So could that be a kid that's eloped multiple times, 589, or
Yes.
is this 589 individuals?
That a lot of that consists of
Multiple.
runs by one child or by one youth. Yes.
Okay.
Sure. So it looks like we had 38 youth who were not in the court-appointed placement location as of the most recent count, and there are currently 27 youth that are out-of-state placements.
Okay. So go back to that first number.
Sure.
Do we? Okay, so what does your department do to track these kids down?
So we have commission investigators, post-certified law enforcement officers, in addition to non-commissioned investigators who keep a pulse on this. We support local law enforcement agencies, our local children's division in locating these individuals, the youth, the individuals that they may have ran to, the locations that they're at, through covert means, through overt means, providing support for logistical information, analytical information, and then even putting boots on the ground to try to bring them back to where they are.
Do you know, in terms of how long somebody's been missing, how, like, calendar days? Can you share with the committee a breakdown of that information?
I'm sure we can get that for you. I don't have that in front of me right at this very moment, but
Okay.
we'd be glad to do that.
And we've, I think with some of the other departments too, we've had some conversations. I have a lot of concerns right now with human trafficking, children trafficking. Obviously, these kids are the most vulnerable. There's initiatives right now to make sure that people are trained with the World Cup coming and not falling victim to all of these people, obviously descending on the state and trying to pull kids away. I'm just, these are alarming numbers always to us, and I would love some more information, again, what you guys are doing to, and I don't know if you have any comments on that in terms of helping to combat the children trafficking, child trafficking that's happening too.
Yes, definitely. No, it's a very big concern of ours as well here at DSS. The difficulty is pinpointing those high-risk youth, and when we investigate crimes against children, traditional what I'd call child sexual abuse investigations, we have a victim that has come forward and made a disclosure or an outcry identifying abuse, usually to a non-offending caregiver, a trusted adult at school resource officer, teacher, etc. What we find in our high-risk youth and child sex trafficking investigations is those youth don't identify as victims, and instead of disclosure, we are actually discovering them out in the field. So that creates complications in and of itself, just victims not seeing themselves as victims and trying to overcome that and help identify them. And we do provide a large amount of training throughout the state to our medical professionals, because oftentimes they're the ones that are having interactions with these youth before anybody within the multidisciplinary team is actually seeing them. So some of the warning signs, things that we can look for to try to get the youth out of that situation, hold any of the traffickers accountable, and ensure their safety, whether that's reunifying them within that familial circle or placing them somewhere in an alternative placement to keep them safe. So we are helping with the World Cup this year with our federal law enforcement partners, in addition to Children's Division, especially within the facet of child sex trafficking.
Okay, thank you.
You're welcome.
And then in terms of kids out of state who are in care, yeah.
I'm going to bring Sarah back up to talk about out-of-state. That's
Okay,
a
thank
little
you.
Thank
bit out
you.
of Matt's wheelhouse. Thank you, Matt.
Yep, thank you.
Thank you. And I'll add on to Director Lindemeyer's piece just a little bit that Children's Division does have one of those specialized teams that we've talked about, is our sex trafficking unit that works closely with STAT. And so, and in our budget book, we talk through, or there's a line item around CACs, and we work closely with our child advocacy centers around trafficking pieces. So just really thankful for them. And leaning into the youth that are placed out of state. Last year around this time, we had around 90 youth placed out of state in residential facilities. And as of just this last week, we had 27 placed out of state, which we would love to have all of those youth back in Missouri. But we are very grateful for the flex funding that we received last session, which has given us the opportunity to, work with our partners here and providers. We're very thankful for them to make sure we're getting those kids home to Missouri.
Yeah, so that was an effort in Senate markup last year. So big thank you to committee members who were a part of that, anybody who supported it. It was a language adjustment only, utilizing existing flexibility to say that if we are paying a high amount for a kid who's a Missouri child to stay in Texas, Colorado, that can we have the flexibility to pay for them to come home and stay in Missouri at that same rate. And so appreciate that, and that's resulted in nearly 60, I'm not going to say 6, 7, oh my gosh, 60 to 70 children moving home.
Because we know that kids do better when they're
Yep,
home,
absolutely.
closer to their supports, their networks, and so we're really thankful for that
Yep.
and continue this efforts.
No, and
to
it's
get
always
that
nice
number
to hear
down.
some good news, so I'm glad to hear that. Thank you.
Thank you.
Yep, that takes us to books 6 and 7, which is going to be Mo Health Net, and they're going to come up here and present their items.
Wait, sorry.
Hi, good morning still.
Good morning. Yeah.
I'm Josh.
We're doing
Moore,
all right.
The Mo Health Net Director. I've been on the job now about 2.5 months, so I've had the opportunity to meet a couple of you, but not all of you, so I will try to make it around to your offices as I can. A little bit of background on me. I was the Pharmacy Director for Mo Health Net for a little over 6 years before taking this promotion. I am a licensed pharmacist, and I did also work in the private industry for a number of years as an account manager for one of the vendors of Mo Health Net, managing prior authorization and a variety of other inpatient stays and utilization management. And sitting to my right is Tony Bright, our CFO. And he
Morning,
is an
Tony.
expert at this. He's going to kick me occasionally when I say something wrong. We'll go ahead and open this up to the governor's amendment. I've got these also noted throughout the document, but I wanted to make sure I hit these and didn't skip over them. The tobacco settlement moved the GR pickup from $50 million to $66 million due to a shortfall in the tobacco settlement funds. And then for the nursing facilities, there's a decreased GR need due to an extension of the DISH funding of about $20 million.
It's tobacco, it's a later page in here, but
It is.
let's go ahead and discuss that one. I understand enough of it to be dangerous, tobacco settlement, and then we go through mediation years prior to where we're living at today. I think we're in 2026, if I remember right, when I write checks. And we're mediating back in like 2005, 2007 range, and correct me if I'm wrong. So my question is, we just found out a mediation that was not positive for general revenue in the state of Missouri. Is there a guess of when the next mediation settlement may come? Well, could we hit 2 or 3 of those in 1 year? Is that possible, or are we probably done at this time? Or do I misunderstand this system?
We would need to work with the Attorney General's office to get that information.
Historically, how often do those mediations close, though? You don't know that? I thought maybe,
We typically work with OA in terms of the settlement funds, and so we would need to get that information from the AG.
okay. We do have one that has just been settled, and we know the outcome just real recently. And we won't, okay. I get it. I do. Don't worry. I understand that, I think. The fact that we're not going to just start, these mediations aren't going to just start falling like cards in a deck out. Because if we continue to go the way we are, people on this side of the table need to realize that right now, this last one makes it look not good for us. The settlement was not in our favor. And if that continues to pile up, again, it's another place going to take GR to be able to pick up these things. That's what I'm one state, I guess. We'll just move on.
All right. The first NDI we have is the Mo Health Net cost to continue on page 1170. The Governor's recommendation, GR $297 million. The total is $1.5 billion. Next, NDI is the managerial care actuarial increase on page 1182. This is $90 million GR, $342 million total. Next is the NDI for the pharmacy PMPM specialty increase. And you'll notice on these, while it looks like our pharmacy spend is decreasing, our core pharmacy is what we're talking about in terms of actual utilization. What we look at on these PMPM increases for pharmacy are accounting for new medications that are coming out. So you have to take all of this in totality to see the full picture of what we're estimating for pharmacy. The next item is the NDI for pharmacy PMPM increase for non-specialty. That is $5.9 million in GR, $20.5 million total. Next NDI is Senate Bill 79 hearing aid services on page 1198. GR $2.4 million, total $10.3 million. This is one that was passed last session to have MoHealthNet begin covering certain hearing aid services. We have implemented that, and we do cover a few of those at this point. They are being requested. This is for the ongoing funding of that. Next up is the NDI for the AEG IGT between us and DMH. This is $117 million federal, $142.5 million total. That reduction is due to better numbers. You'll notice that throughout our books, we update the General Assembly every month on what our projections are. We're trying to do the best crystal ball we can, but utilization does vary, so we come back and update as we can. Next up is the NDI for the public GEMT on page 1205. That is $15.8 million total, or federal, $22.5 million in total. This increase in authority is needed to make the payments in state fiscal year 27 because we're going to do a double payment to catch up as this is a new program. Next up, we have the NDI for the outpatient fee schedule trend on page 1209. GR of $2.1 million. Total is $9.9 million. We base this on rates that CMS provides to us on a calendar year, and for calendar year 2027, the increase is 2.4%. Next up is the NDI for the tobacco settlement GR pickup on page 1212. We've already talked about that, so we'll go ahead and skip over to the next one. And I am just going to hit some NDIs at this point. Skip a couple pages to page 1223. That's the MHD admin AFRA increase. That is $250,000. That is a fund switch.
What, we're talking about $250,000 out of a book that's got several dollars in it. Why is this NDI being funded with federal funding?
This is a fund switch to utilize AFRA funds rather than
To what funds?
AFRA, ambulance, federal reimbursement allowance
Okay.
funds rather than
Believe it or
general
not, I
revenue.
knew that, but you guys probably don't recognize it where you live at, but you have a lot of acronyms, and they're not the ones that I grew up with.
I agree.
Thank you.
We do, and when I switched from being pharmacy director to Medicaid director, I got to learn a whole lot new acronyms that Tony's been helping me out with a lot.
Yeah, the appropriations staff started me with a 3-ring binder notebook and about 5-6 pages at a time for me to memorize, and I finally said, no.
Fair enough, fair enough. All right, next up, we have the NDI for the additional MMIS staffing on page 1225. GR of $90,000. The total is $581,000. This request was finalized after the department request. We plan to ramp up our MMIS staffing. Toy is going to probably talk about a number of IT projects she already has. We're going to talk about even more now, coming up here in a little bit. But we need to ramp up our staff so we can actually implement these programs. In the pharmacy unit, we're currently implementing a new pharmacy benefits administrator contract. That project is 309,000 hours on the vendor side. Our staff are meeting with them basically close to 8 hours every single day, going through the requirements of the old system, mapping those to the new system, because we are taking a system that has been around and is in COBOL And now we are moving that, basically punch cards. We're pretty close there. But moving that into a modern system where we do electronic prior authorizations, all of that. And that takes a lot of communication of what enhancements do we want today, what enhancements do we want in the future, and how do we map and make sure that it's a better experience for our providers and participants.
Senator Crawford.
You mentioned the electronic prior authorization piece. Can you talk just a little bit about that? Is that new to you? Are you just moving into that, or have you been doing it?
Woo, Senator Crawford.
Whoa.
Pretty ominous.
I think I wasn't supposed to ask that question.
Have somebody on your side when you ask
It's either
questions.
good or bad.
Yeah, so we've been doing some electronic prior authorization for a long time, specifically for pre-certification of DME type devices, wheelchairs, et cetera, diapers, those kinds of things. That's part of the contract that I used to manage. Pharmacy, on the other hand, we do a lot of prior authorization transparently through the system, where we'll look back at the medical history and say, oh, this person has rheumatoid arthritis. We'll go ahead and approve this without any kind of documentation having to be sent in. However, there's about 15,000 faxes that go to the pharmacy help desk per month for manual prior authorizations and about 30,000 phone calls. That's not electronic prior authorization. That is pretty old school. So what we are moving to in pharmacy is we are going to then allow the provider's EHR system to communicate directly with our system to request prior authorizations, so that the provider doesn't have to leave their workflow and go work with paper and send that in. So we're hoping for a dramatic increase in improvement of the satisfaction of providers.
So just to clarify, you're doing this for things other than the pharmacy? You're doing that for other things as well?
To a certain degree, for other things outside of pharmacy, we are doing it. There are some items that we're not. For instance, there's a gene therapy that's $4 million. That's going to require some communication outside of the electronic prior authorization.
Understandably,
automation.
yes. Okay, I had been told that you were doing some things other than pharmacy, and obviously this is a big topic that we've talked about for the last few years, and could you have somebody come by and talk to me about how that's working on the non-pharmacy side, and
Absolutely.
maybe get me some more information?
Absolutely.
Perfect, thank you.
All right. With that, the next tab that we're looking at is the NDI for the Transform Medicare Enrollment Team. That's on page 1239. Here, when this was originally appropriated to us, it was as GR only. We are able to capture federal dollars for this, so this is the federal dollars portion of that request. $206,000 federal, $206,000 total. Next up, we have the NDIs, and I'm going to have Toy come up here and sit by me in case there are any questions, because these are all of the technology questions that we're going to talk about. NDI for the MMIS core solution on page 1259. The GR here is $3.1 million. Total is $31.2 million. Next up, we have the NDI for the MMIS operational cost increase. These are standard increases that we do every year for our vendors that are currently existing. They have price increases built into their contracts. $4 million in GR, $17 million total. Next is the NDI for MMIS interoperability rule on page 1265. $189,000 GR, $2.2 million total. Next, we have the NDI for the MMIS security risk assessment on page 1268. That is $125,000 GR, $500,000 total. You'll notice that there is a decrease from what we had originally requested. The bids came in lower, so we lowered how much we're requesting. Next up, we have the NDI for MMIS enrollment broker solution on page 1272. GR here, $1.8 million, total $6.3 million. Next, we have the NDI for the MMIS prior authorization solution on page 1276. $900,000 GR, $9 million total.
Senator May.
Good morning. My question is this. So I see that, most of these, the biggest chunk is federal dollars.
Correct.
So where are we in that ratio for Medicare, federal versus?
For Medicaid, for new system implementations, technology that's been approved by CMS through the advanced planning document process that Toy's talked about a couple times, that's 90-10 funding.
90-10.
And then for operations afterwards, we can receive enhanced funding if that solution is certified at 75-25. So 75% federal, 25% state. Sure.
Okay, so after implementation, it's 75-25.
Correct. There are some scenarios where it would be 50-50 as well, depending on what service is being offered.
So there's usually a short period of time that you do the 50-50 because you have to go through the certification process with CMS. But then as soon as you get through the certification process, normally they back channel that 75-25. So there's a short period of time. Unless your solution cannot meet the certification qualifications, then you would stay at that 50-50.
Okay.
And we do build into the contracts that if we do not get certified, that it is the vendor that's at risk for that money.
Okay, absolutely. Thank you.
Next, we have the NDI for MMIS transition and turnover services on page 1280. Talked a little bit about this earlier when I said just how many hours it takes the staff to work to get these changed over. It takes a lot of work on the existing vendors too to implement, change their systems, to work with the new systems because we can't change every piece of the car as we're driving down the highway. We change one piece at a time as we're driving down the highway, but we have to keep operating and moving along. That's going to be $2.4 million in GR, $24.4 million total. Next, we have the NDI for the MMIS EVV solution. That's on page 1284. EVV stands for electronic visit verification. The GR here is $421,000. Total is $3.1 million. Next, we have the NDI for the aggregator access rule on page 1287. GR, $1 million. Total, $2 million. All right. Next up, we're not going to skip all the way to the next NDI. We're going to go to core.
Senator Nuremberg first, I believe.
Okay. And I'm still trying to, again, wrap my head around all these different IT requests, the vendors. So are all of the systems on this list as well? Do you know, this was passed out to us in terms of the different.
That list is specific to Family Support Division
this
for
is
your
like-
eligibility.
Can we have something similar
Yeah,
then for
absolutely.
Medicaid? I think would be really helpful.
Absolutely.
And what I'm trying to figure out again is, like, for example, you said like there was the NDI for $2 million. You said the bids came back lower, so now we're okay with the 500. I would just love to have some more insight into the bid process, and can we knock some of these other ones down? And then what contracts have ended because in the past because they haven't. For one reason or another, when the department has ended a contract with a specific vendor. I just want to make sure we're not going down the same rabbit hole as that we've been with some of the other mess that we've been walking into.
Absolutely. And one of the things that we do is as we implement new pieces of a system, sometimes the existing contract has maybe 10 parts to it. And so we'll take 1 or 3 or 5 parts out of that contract. So then we'll reduce the size of the old contract for those 5 services that move on.
Okay.
But during implementation, we are paying for the implementation of the new service and the operations of the old service.
Okay. But again, if we can get a breakdown, I'd love to see who the current, on the current programs, who the current contract vendor is, the services that they provide, and then when you said, for example, like you already have, even though we haven't appropriated, but I understand you've started the bid process, that some of them are coming in less. If we can just have some information there. Thank you.
Absolutely.
Yeah. And make sure you supply for the whole committee.
Oh, yeah.
Yeah, thank you.
Okay, this touches IT, but not near as deep. So 1320, I think we're getting ready to go past it.
That's the one I was going to, actually.
Was it?
Yep.
Okay. Where's DSS in the process of acquiring this statewide closed-loop social service referral program? Where are we at in the process? And then, of course, I'm identifying the governor reducing this to 0. So is there an impact or no impact with that reduction?
So what we're doing with this one is we're moving it to the Rural Health Transformation Program. We're going to utilize the funds there because we think that's going to better line up with what the intent of this program is. So I don't know if Toya, you want to talk a
Sure.
little bit more about that?
Yeah, so we, when we were going through the rural health transformation planning process, we did some surveying on needs for our rural providers in areas, and one of those was tools such as a social care referral platform. So we had been in the planning process for this, and the Torch had kind of been a baseline for those 6 hospitals that participate in the Torch that were using the Unitas platform to test this out. So really what we identified is that this was a strong need in the rural communities, because most of them already struggle to pay for their, electronic medical records. So paying for an additional platform to do this specific type of work was a struggle for those areas. So we moved it over and thought it would be fiscally responsible to integrate that as a part of the opportunity to implement a statewide social care referral platform so that these rural health care providers could access that, and then we could work on integrations with any of our more urban area facilities.
Okay, this is just a thought in my mind while you said that. Within the area that I represent, some people, when you talk about implementing technology and paying for it, I have a hybrid of hospitals, some associated with probably the largest healthcare provider in our state, and then I have community-based, and probably their financial ability to do some of those things are different. So I'm not wanting an answer, but know that I'm thinking about that. Who, because you have a building there, is that rule on everything? Or do you really, and this is me stating it, no question, or is it one of our community-based facilities that do not have that tie to large corporate entities, whether they're profit or nonprofit?
I did want to mention we are using a state strategy as well to apply for 90/10 funding for long term, because we do know that for sustainability purposes, the rural health transformation grant only lasts for the 5-year designation. So we are in a aggressive process right now of applying for that enhanced federal funding, because if the state is going to maintain this system, we want to make sure that fiscally we have that federal match. So we are starting that process right now, in addition to using the grant to kind of offset what we would use for the general revenue component.
Okay, thank you. You have another, Senator May?
So you're moving it to the, so the funding here that's zeroed out, you're just moving it to another source of funding?
Correct.
Okay, and is this for the closed loop program? Is that for the entire state?
That's the plan, yep.
Okay, thank you.
All right, the next NDI we have is the PACE rate increase on page 1382. The GR
Let me-
here.
Before you
Oh,
finish that, because I have a question on 1325,
Okay.
which is Health Data Utility, HDU, right? Another one of these acronyms. Current timeline on that one, what does it look like?
So with the health data utility, as we went through the planning process with rural health transformation, it became pretty apparent that that data strategy was going to be critically important for some of the success pillars that we established in the rural health transformation grant. We have a APD, and we're in the planning process right now with our 4 health information networks in the state. We are now going to go through an update process with our advanced planning document to really augment the plan to ensure that it is going to meet the provisions of the success of what we need for the rural health transformation grant. And then we will start within this fiscal year working towards implementation. So it will have to go parallel to a lot of the goals that are aligned in the rural health transformation program, which have goals for this year, next year. Each year we have programmatic goals that align with that. So that is where we're currently at, updating our APD plan and getting that, because for health data utility we also have 90/10. So we're in the process of updating that so it aligns with the rural health transformation goals.
I think we're done talking this time. I'm glad I have my dreams about fishing and cows instead of whatever you have to dream at night. So, thank you.
All right. Next up, we have the NDI for the PACE rate increase on page 1382. The GR impact here is $244,000, $690,000 total. Rates for this are set at 5% discount compared to what the state would have otherwise paid for the population. More details on that is on page 1385 on how we calculate. Next, we have the NDI for the premium increase on page 1400. GR impact, $11.9 million, $35.9 million total. This is really due to the Medicare A and B premiums. They're adjusted annually in January. The increase for A was $47, for Part B was $17.90. So this is multiplied out. All right, next up we have the NDI for the nursing facility rate, federal reimbursement amount authority increase on page 1414. This is a fund switch here, $9.5 million. That's the end of that book. Move to book 7. First tab I'm going to look at here, unless others have questions about ones before it, the NDI for hospice rate increase on page 1455. GR, $152,000. Total is $429,000. This is based on a 2.8% increase, and these are submitted to us by CMS. Next up, we have the NDI for the AFRA authority increase, page 1458, $975,000. Next, we have the NDI for the NEMT actuarial increase on page 1467, $818,000 GR, $2.3 million total. Next, NDI for GR pickup for managed care one time on page 1493. This is $375 million in general revenue. The drop from the drop from the department request to the governor's recommendation is that we have better numbers. Next, we have the NDI for the average commercial rate, page 14.
Senator May has a question.
Oh, sorry, go ahead.
So, on this right here, the pickup for managed care.
Mhm.
Talk to me about this. This is, let me see, the years.
Yeah, we received a one-time funding last year for this.
Yes.
So that's why we're coming back to ask for the money. Again, it's really continuing funding need. Last year was one time, so that's why we're
because
here.
managed care, it's like, you know, all those facilities that, you know, are we talking about facilities that employ the individuals to do? No, I'm tripping. I'm on the wrong thing.
This is managed care, so this is
It's different,
Healthy
yes.
Blue, Home State,
Yes.
and United Healthcare.
Yes.
Yep, those are
Yes,
the
three
three,
of
and
them.
they help manage our population.
Yeah, I'm ahead of myself. No, I was thinking about my centers, you know, that.
Oh, the FQHCs?
Yes.
Okay.
Yes.
Yep, those are going to be a little bit later on here.
Yes, I ain't got there yet. Okay. Thank you.
All right. So yeah, on page 1495, the NDI for the average commercial rate. This is an IGT, so $175 million federal, $233 million total. Next, NDI is the hospital care fund switch on page 1529, $415,000 from FRA. Okay, next non-NDI that we're going to talk about is from the core, the federally qualified health centers distribution on page 1546. GR here, $257,000. That's down from $5.7 million. And this was reduced, the CHW initiative by $5 million, and then the FQHC physician scholarship program by $500,000.
Senator May?
Yes. So why is this cut here? Tell me about this. Because right now, the federally qualified health centers were having some challenges when the feds made a change, and they were really struggling because they weren't able to get their normal federal allowance. So our role here is,
Yeah, this is one of the difficult budget decisions that were made by the governor's office, and we support the governor's budget. There is going to be some of this that will be picked up through the Rural Health Transformation Program. So we are working with the FQHCs on a plan to shore some of this up.
Yeah,
So
it may not, excuse me,
Go ahead.
may not go back to full, but it is, some of it's going to be transferred, we hope.
There is
to
some
that
discussion.
216 million at least for 5 years.
Correct.
so how many federally qualified? Because
Sorry.
I know in my area,
Pending CMS approval. CMS
Yes.
is watching every penny that goes through that program.
Yeah, because, I mean, it started on the federal level with the federally qualified health centers, but these are the neighborhood health centers, you know, in the community, that people that are really have a huge population of people that come there for health services. So are we, this is concerning to me. So tell me, can you tell me, expound on our role with the federally qualified health centers? Because I know that they get most of their dollars from the feds, right?
So these are grants above and beyond the payments for the services that are being rendered by the federally qualified health centers. So they will still get paid for physician services, lab tests, all of those services that we normally pay through Medicaid and MoHealthNet.
Okay.
That isn't those dollars. These are additional grants.
Okay, very good.
Did you? Okay, please continue.
All right. Next one, very next tab is going to be the core for women's and minority outreach on page 1552. This was originally in the department request is $4 million. The governor's recommendation did zero this one out. Next tab is the core for substance abuse prevention for Jordan Valley on page 1557. In the department request, it had been $2.3 million total. In the governor's recommendation, it was $1.1 million. Then on the next tab, the core for substance abuse prevention on page 1562. This is a core reduction down GR $500,000 and total $1.6 million. Next NDI is going to be on page 1590. That's the NDI for the FRA authority increase, and that is $21.2 million total. And that's a fund switch. Next, we have the NDI for the...
On
sorry.
this pickup here, is what I'm going to use. CMS have any, does any of this got to be approved by CMS where we're doing this increase? No, we can do it.
This isn't a rate increase on the tax. And then on page 1657, the NDI for extended women's health services, $1.8 million GR, $3 million total. This appropriation was previously with DHSS. It's moving over to MoHealthNet. We're going to submit a waiver so that we can get the federal match. These numbers are IGT. And that is the conclusion of this book as well.
Perfect time. Thank you very much. Does anybody from your group have any closing comments before I hit the gavel down?
Nope, we appreciate your time.
We are adjourned.